welcome back to my YouTube channel. Today we are going to discuss about osteoclastoma. This is the most repeated topic in NEET PG orthopedics. The guys who have been solving NEET PG PYQs, you have seen like this question might have come at least 4 times in the last 5 years. So this is that important. But every time it comes, the examiner asks it from a different angle. So today I'm gonna show you exactly what those angles are, and so you never get an osteoclastoma question wrong again. So let's not waste our time. Let's dive into the topic. First, I want you to see this radiograph. All of you can see this. This is one of the radiograph, and the second one goes this. And the third picture is histopathological slide. So let's see what are these picture by picture. This is an X-ray of knee joint. I mean, this you can see the upper part of the bone is femur and the lower one is tibia. So this is proximal tibia. The lesion you are seeing here is that type of lesion is soap bubble lesion. Soap bubble lesion. It appears as soap bubbles, and this is eccentric. It means it is not in the center, it is towards the side. So this is one of the radiograph you keep in your mind. And the second one, you can see this is the x-ray of the hand, like forearm. This the lesion which you are seeing is in the bone radius. So the site is distal end of the radius. You can see a soap bubble appearance here too. So you have to remember, like you can remember this picture too. And the third picture comes histopathological examination. As you can see here, this shows multinucleated gene cells, osteoclast like gene cells. So if you find any of these three pictures in your examination, just remember osteoclastoma. So most of the time you can get it right. Let's see other aspects of this also. So let's come here. The osteoclastoma, it is also called as gene cell tumor of the bone. So before diving into the topic, what is osteoclastoma of a tumor of osteoclast cells. So this is very basic thing you need to know. So this is a neoplasm. It is not a true neoplasm, but it is a potentially aggressive lesion. This is not a malignant one. Yeah, it has chances of getting malignant, but as of it, it is not a malignant one. Fine. So let's see about the epidemiology here. Let's see you can see the age here is 20 to 40 years. So when osteoclastoma question you are getting, it's always 20 to 40 years. So the gene cell tumor, 20 to 40 years. This is what you have to remember. Sex में slight female preponderance होते हैं, and it is common in Indian population. Now let's see about the site. This gene cell tumor, it is seen in epiphysis of the long bones. You have to remember this to get your question right. And the most common locations are distal femur, proximal tibia, proximal humerus, and distal radius. Distal radius तो classic है, and etiology is unknown. And the MRI, low to intermediate signal on T3, high signal on T2. I think this is not much needed. The most commonly asked one is about the radiology. So you can see the radiology. I've shown you the pictures before. The lytic lesions in the epiphysis. It is expansile and eccentric, as I've said you, and there are non-sclerotic margins and no periosteal reaction seen, and it may extend to subchondral bone, no matrix calcification, and soap bubble appearance. In these are the radiological features of gene cell tumor. You have to remember this, like this angle is tested more often in your examinations. So you have to remember at least 3 to 4 points. Soap bubble appearance, classic feature, lytic lesion, and it is eccentric, and non-sclerotic margins are there. So important points up till now here. It occurs in epiphysis, age less than 40 years, and it is most commonly seen around knee joint. You can also see it in distal radius too. Expansile lytic lesion with non-sclerotic margins, and no matrix calcification. And most of the times it is epiphyseal, like, but it can also cross epiphyseal line and extend to subchondral bone. So these are the important points you have to remember. Done. Let's get into pathology. Iska pathology, yeah, you find multinucleated gene cells. So numerous uniformly distributed osteoclast like gene cells. Whenever you find a slide like this, you have to go for osteoclastoma. And you can, there may be other pictures where you can there are other things you have to diagnose, like differential diagnosis cutting. First, let's talk about two things. First one is osteoclastoma, second is chondroblastoma. Osteoclastoma and chondroblastoma, क्या similarity है? Osteoclastoma and chondroblastoma both occur in epiphyses of the bones. These are the two tumors which occur in epiphyses of the bones, right? Then how do we differentiate this? Whenever there is a question, you get osteoclastoma in 20 to 40 years. This is not seen in young, it's given wrong here. This is, yeah, middle-aged men, 20 to 40 years may seen, whereas chondroblastoma is seen in young people. So that's the reason in young people chondroblastoma is seen. So there you find growth plate in the X-ray, yeah, that physeal plate. Whereas in gene cell tumor, you don't find growth plate because it occurs in 20 to 40 years. X-ray features में क्या difference है? This is expansile, lytic, non-sclerotic, and no calcification. Here, it is well-defined lytic lesion with sclerotic. The next thing you have to see is aneurysmal bone cyst. Aneurysmal bone cyst is also eccentric lesion, but it is seen in metaphysis. You can see the X-ray features here. And the other thing is chondromyxoid fibroma. It is also seen in metaphysis, and iska X-ray features are well-defined lytic lesion with sclerotic margin. Now let's get into treatment part, the last part of our explanation. So treatment is done with extended curettage, that is with liquid nitrogen, phenol, or bone cement, and then followed by autologous bone graft. These are the things you remember because this is tested once in the NEET PG PYQs. Clinical features not much importance, but you can see once: pain, swelling, restricted movements, pathological fracture, and there are no constitutional symptoms. The most important point you have to remember from this slide is it is a benign tumor, age 20 to 40 years में होते हैं, and the location is epiphysis, lytic, expansile, eccentric, non-sclerotic, and no calcification. And you also have to remember soap bubble appearance. So if you remember these points, that is more than enough for your NEET PG question solving. Let's see what are the NEET PG questions here we got. So the thing, we'll just get with this. Yeah. The first question is, a 24-year-old woman presents with knee pain and swelling. X-ray shows eccentric expansile lytic lesion involving the epiphysis of the proximal tibia with a characteristic soap bubble appearance. You already know the answer. Chain cell tumor. Second question, young adult presents with pain and swelling around the knee, and the imaging reveals an eccentric expansile lytic lesion involving the epiphysis of the proximal tibia and suggestive of the gene cell tumor. They already gave you the diagnosis and they are asking you the treatment option. You already know the answer: extended curettage with bone grafting. Fine. The third question, give biopsy. This is a 32-year-old woman presents with pain and swelling around the knee, and histopathological examination reveals numerous multinucleated gene cells, and they are uniformly distributed among mononuclear stroma cells. The most likely diagnosis is gene cell tumor. And the last question is, a 28-year-old man presents with gradually increasing pain and swelling near the wrist for the past few months. So the X-ray again reveals eccentric expansile lytic lesion involves epiphyseal region of the distal radius with a characteristic soap bubble appearance. But the thing you have to remember is they may not always describe you how the X-ray reveal. They just give you the symptoms and the age and then the X-ray picture. They may not always describe you eccentric expansion. You have to see and identify that. So practice reading the radiograph so that you can get this question right in your exam. Thank you for watching. If you want the PDF, I'll post it in the Telegram channel. If you like this video, please like, share, and subscribe.